Chair now recognizes Dr. Dexter for 5 minutes for any questions she may have.
Thank you, Madam Chair, and thank you all again for your service and for being here today. Really, really appreciate it. One thing that struck me listening to all of you that I continue to struggle with being new here in Congress and coming here as a physician is what feels like a binary choice between community care and in-VA care. I know nobody here is advocating necessarily for one versus the other, but I think that is how it feels in this committee at times. And one quote that one of you shared was, community care is not an alternative to the VA, it's an extension of it. And that should be what it is. But it's not what it ends up being, because this is a fixed pie that when we take money out of the VA direct care services and get it out to the community, it is a loss from being able to build up the VA care to the quality that we know, Dr. Hunter, you spoke to. When we get it to our veterans, it's better quality care and they're more satisfied. The problem is, as Ms. Keenan and so many people have talked to, it's getting them that care and having them available or be able to get availability. So one thing that I'd like us to try to center, it's truly a bipartisan endeavor, I believe, is to get our veterans at the center of what we're trying to do and make sure that their needs and their access and quality are what drives our decisions rather than protecting community care, protecting VA in-district care. So Ms. Hunter and several of you have talked about the data, and I wonder what kind of data would be most compelling for you as a veteran, and so I'll start with you, Dr. Hunter. What would be the most compelling data for you as an advocate for veterans, especially our women veterans who are underserved in so many ways, but I don't want to be disproportionately focused on that. What would you want to see? What would help you make decisions about advocating for community care versus in the VA system care, direct care?
Thank you so much for that question. When we look about where the compelling data is, I'll put my researcher hat on, I look at outcomes, right? And outcomes matter, and we know that patient-centered outcomes are better with VA care because of the coordination, which doesn't mean that community care can't get there, but the coordination needs to get there. And one thing you noted that I really want to touch on is some of the concerns that are coming from the fixed budget. And what we're seeing more and more is mandatory spending being directed towards mandatory spending for community care, which necessitates making cuts at the VA. And we're hearing from several VA providers that results in not being able to fill positions, not being able to actually hire the people they need to hire, which creates an unfortunate cycle of demonization of the VA because we have lower morale, lower staff, which leads to longer wait times and sometimes worse outcomes. So again, centering the patient in the outcomes is absolutely essential there. And I think as we're looking at this and we're talking about choice in all of this, and choice is essential, but we need to ensure that we do not remove the ability of veterans to choose VA and to choose a provider at the VA as a one-stop shop for their care.
No, I appreciate that. And so I think what I certainly am interested in working across the aisle and with this subcommittee on is centering how do we get the data that we need to make the decisions that really do deliver the quality, access, and service to our veterans that they deserve. And it may be that it is wound care in the community is the most effective way, especially in rural areas, but let's have the data so that we understand how long it takes to get for a wound care appointment, how far you have to drive, and then let the patients have a choice. And so I do think making clear at the VA that patients or veterans have a choice is important, and I heard several of you speak to that we should not be trying to deter people from getting care at the VA, but we should not shield them from a choice, but making that choice tangible, and I hope that everyone on this committee can center that. I look forward to working with you all on how we get policy amendments, however it looks, so that we can get the right outcomes for our veterans. Because again, I don't want to be shielding Optum and TRICARE and trying to get them dollars. I want to get those dollars to the VA and to our veterans. Okay, thank you. With that, I yield back.